Thank you, Dr. Hu, for talking to us about your research presentation upcoming at the ASE meeting in Seattle. So what inspired this research, and what's the basis of your research?
Sure. So the theory behind my research, and my interest is in education theory and surgery, is that with a lot of these restrictions that are coming out more recently, folks are starting to become a little bit concerned that the level of independence in residency training and the amount of operating hours that we're getting is not as much as it used to be. So I think that what's really necessary in the long run is a shift in the framework of how surgical education is judged. Up to this point, as you know, most of what we're judged on in terms of our training adequacy is volume of operations and the amount of time we spent in residency. We progress through 5 clinical years, we do a certain number of cases in certain categories, and we're considered proficient. And really that's not a direct measure of our technical ability. So what I want to do is to do some research and see if we can move away from that kind of decades-long framework and go into more of an adaptive framework of education where people are being trained at the pace that is determined by their proficiency at every step. So that's really the foundation of why I'm doing this kind of research.
Okay, so tell us about CUSUM.
Sure. So cumulative sum, and I'm just as confused as you about what's the appropriate pronunciation, but I like to call it CUSUM. CUSUM is based on a very simple concept. It's based on a person performing a series of identical procedures, and with every procedure that he or she performs, they are marked as a successful or a failed attempt at that procedure. CUSUM is a very graphic kind of a metric. Every successful performance of a procedure is kind of a decline in a slope, and a unsuccessful performance is an incline. So as a trainee slowly acquires proficiency, their learning curve, if you will, changes from an inclining slope to a leveled off slope to a declining slope. And once a trainee adopts this leveled off or declining slope, they may be considered CUSUM proficient. And the idea is to train people at a certain pace so that they are always at a task in which they are acquiring CUSUM proficiency before moving on to the next more difficult task.
Okay. And how about your study? What did you find?
So our study was looking at medical students. We're starting from the basics. In simulation training, they're training in central lines, intubation, and suturing. And we've done a randomized control trial where we have a group of medical students who are using a traditional simulation program in which they're allotted a fixed amount of time and they can practice simulation in any order that they choose. And we also have a CUSUM guided group for which they are progressed along the simulation curriculum by doing suturing first. And when they're CUSUM proficient in suturing, they move on to intubation. And when they're proficient in that, they move on to central venous catheterization. And when they've become proficient in all 3 tasks, they stop their training. So in this way, folks that either have a leg up from the baseline in terms of their proficiency, or folks that learn faster will finish their practice sooner in the CUSUM group. So what we found is that the CUSUM group ended up with the same level of proficiency as the control group, but they used about 20% less simulation time, which of course translates to reduced resources, both in terms of material resources and personnel costs.
Interesting. And how is proficiency judged?
Right. So that's a very difficult question in some ways. Of course, traditionally, there's all kinds of metrics that are out there. The objective structured assessment of technical skills is one that's commonly used. The OSATs, there's kind of task-specific checklists as well as global rating scales for that. We've really adopted the OSATs kind of framework in terms of the task-specific checklists, and we did design checklists for both the intubation and the central venous catheterization, and then pulled a suturing OSATs checklist from the literature. So basically, every time a trainee performs any of these tasks, they're evaluated one-on-one by a trainer using these checklists. And then based on how well they score on the checklist, the procedure is either a success or a failure.
Gotcha. Okay. Very good. So you'll be presenting your study when and where?
So this will be at the Association for Surgical Education this coming April on the 24th at 8:30 in the morning.
Great. We look forward to seeing you there.
Thank you.
Thanks. Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.